webinar. We are on Zoom with our panel. We are also broadcast live on our Facebook page. And if anyone joining has questions, you can type those in on Facebook. And if you're joining us on Zoom, you can type them into the answer. And we will try to get to some of those as we go along. We are unable to answer any specific medical questions, but any individual health concerns should be directed to your provider. So without further ado, we can get started. It is the question on many parents' minds right now: how can my kids safely return to playing sports? So today we are joined with sports medicine specialist, Dr. Jeff Nepple and Dr. Mark Halstead, and also the pediatric infectious disease specialist, Dr. Jason Newland. We are going to be discussing the recently released recommendations and the phased approach for young athletes returning to organized play. We have lots of questions tonight, so we will try to answer those from our readers. And we have some just to get started, and we want to hear from everyone about the news that came out today about maybe some revisions happening. So our first question is, what are the joint recommendations for returning kids to play in St. Louis, and who contributed to making the recommendations?
Sure, I can take that. So all three of us have been part of a task force across the different hospital systems in St. Louis, from Barnes and St. Louis Children's, WashU, to Mercy, SSM, Cardinal Glennon. So we've had a great group of people from different perspectives. We all three come from kind of different perspectives. In this group has sort of taken the best evidence out there to kind of come up with what our thoughts are. So this has been an ongoing process over the last month or two to try to figure out how do we safely do this, realizing that sort of a stepwise approach is going to be safest. These are very uncertain times with the virus, that gradually working back into sports to trying to navigate this, I think, has been the hope that would give us the best chance of being successful. I think it's been a difficult process, and I think there are even more difficult times ahead. But if we're going to try to get kids back to sports, and there's great value in getting back to these things, I think if we can do that safely, I think the phased approach and the recommendations from the task force, I think, have hopefully been helpful. We live in a region of multiple counties, multiple health departments, and things that we're trying to give a unified message across the St. Louis region.
And the recommendations follow a phased approach for the return to play. What phase are we in now?
So I can take that. So we've worked through starting at phase one is basically, maintaining social distancing, keeping kids apart from any kind of contact, and that's then followed into kind of brief periods of contact where athletes might come together for a brief period, but for the most part they're apart, and then moving into phase three, allowing sort of some games, trying to do this in scrimmages or local games, avoiding mixing regions, travel teams, all those kind of things that increase the risk of doing everything. So we've been in sort of this phase two situation where we're allowing intra-squad contact and scrimmages, with the hope of moving forward if criteria are met. We just are, I guess, in a trying time where things are going the wrong direction, unfortunately, and that's likely going to prevent us from moving forward and maybe even force us to move back. Jason, you might be able to provide nice perspective on where are we on July 15th as this point.
So thanks, Jeff. Our phased approach was made for two reasons. Obviously, one is the health of the athlete. Two is because of the virus and the SARS-CoV-2 virus causing the COVID-19 illness. And part of the task force, which has been meeting since early May, has been watching what the cases and new cases are occurring in our community. And when we say in our community, we're really talking Metro East. We're talking St. Louis City, St. Louis County, St. Charles, Jefferson, and Franklin County has been kind of our focus. And if you look at what's been happening, we want to see stable cases or decreasing number of cases, and we mean new cases on a daily basis, as well as that our hospital systems are not being filled up. We've all seen what's happening in Texas, Arizona, and Florida, and that is all very concerning. And we know as we've opened up, things have started to go increasing in cases. And so what we have learned over the last couple of weeks is that we're setting new record highs. If we look at the state of Missouri, it just says yesterday, there was over 900 cases. And in St. Louis County alone, there was 217 new cases reported, which is the second highest total to 220 that was last week. And we essentially has not been underneath 100 in about 2.5 or 3 weeks, when we were at one point seeing about 30 to 40 cases, new cases a day. That's just in the county. And frankly, across the region, we are seeing increase in cases to the point that we're having to have real big questions about what we're doing. And I think what we're also learning, I think it's super important for everyone out there listening, is who are our new cases? What age groups are we talking about? If we look back in the early part of the pandemic, what we saw was some nursing home outbreaks. We saw some of the elderly and those in the most vulnerable populations ending up in our hospital because they are at the greatest risk. But what we've seen over the last 2 to 4 weeks is that it's been among the youth and young adults. As a matter of fact, we learned over the last couple of days that in the young adults, the 20 to 29 years of age range, their cases have increased 195%. The youth has also, that 10 to 19 age range, has also increased on the order of 50%. So we're talking dramatic increases in the cases among youth, those who would be playing youth sports, as well as in young adults. Now, have we learned of any transmission actually during sports or during that? No, we have not. But what we have learned and what we know is that a lot of these are from activities done outside of these. It's going to the large parties. It's going to maybe a graduation party or times and not going when we're sick, or doing things when we're still having illnesses. So if we're going to continue to have sports, if we are going to get ourselves to having even school sports, our behaviors have to change, because there's no way that we can continue to do this, because all we're doing is putting others at risk when it comes to the virus.
Mm-hmm. And do you think different sports should have different approaches with respect to COVID precautions?
So we do. We and the task force spent a lot of time discussing this. It was one of the best discussions among the experts, was like, okay, how are we going to divide this? Because, right, risk is different. This virus is transmitted mainly person to person through respiratory tracts, right? So me coughing, me breathing is going to be the primary reason. Now, of course, lands on hard surfaces. I touch it. I then touch my mouth. I could get it. But the main reason that we get this is person to person. So those sports with high contact, wrestling would be the prime example of the most high contact, but other high contact sports, baseball, high contact, you're right next to somebody. Now, it's not the same as basketball or some of these other sports. So yes, we do grade that. And then we have low contact sports. So cross country, golf, tennis, swimming, some of those have a less risk period. Now, regardless, if we get people together, even in a low contact sports, we increase that risk. So it is different. And so we allow different things at those times. But phase one for anybody, for us, is we're social distancing maximally all the time. That way we're preventing any potential spread.
Mm-hmm. And I have a question from one of our readers, our viewers. Is it possible that we will have sports this fall if classes are virtual?
So I can tackle that one, because that's directly related to Misha. One thing that we talk about with sports for fall, if they're high school sponsored sports, there is no possibility for high school sports at your school if your school is doing all virtual learning. There has to be some degree of in-person learning. So that could be a hybrid model as an example. So I know some schools are going to an approach where they're going to have a phased, where they do days that half the students are there, and then the other half of the week, other students are there, and then they may do some virtual learning. That's acceptable, but there has to be some basis of in-person learning. If it's like it was in the spring where everything was shut down for schools, or say your individual school decides to go all virtual, then your school is not eligible to participate in after-school sports.
And can you let everyone know what Misha is?
Yeah, so
the
Misha is
document
the
you're
Missouri
referring.
State, so Missouri State High School Athletic Association, and they sent out recommendations today to the athletic directors and activity directors at each of the schools and the school administrators. So they're they're looking through that information now and processing that, and then we'll be probably relaying that out to their respective schools with all the different sports and coaches over the next several days to the next week, to let all of them know basically what the updated recommendations are for those particular sports.
And there's definitely an overlap between our state guidelines and then the local guidelines, because again, the things are a lot different in different parts of the state. For a long time, we've been much more restrictive here in St. Louis. I think the virus is spreading in a lot of other areas now that our guidelines and Misha guidelines, I think, are getting closer together than they probably would have been several months ago. But I think it's important for parents and coaches and athletes to kind of understand that there's state guidelines, but there's also local guidelines, and guidelines from our county. Which county you live in affects this significantly, for better or worse. So you have to kind of understand all those different layers when you're thinking about this.
And we will be posting that document with all the information so that our viewers can see, if they can check their county. We'll have all of it posted later in this week on our website, because that's really helpful. There's so many layers.
Yeah, so if you search now, you can probably find the task force document from a week or so ago, but there will be a new document in the next couple of days that I think is a little more reflective of some of the challenges we're dealing with that a couple of weeks ago I don't think we saw necessarily, as that's where we're headed.
And we've been talking about youth sports, but what age groups are being affected, and should youth sports approach return to play differently than, let's say, college or very young kids?
Yeah, so if we just look at the virus and what we've seen through this pandemic, and who's getting infected, and that percentage just of our positivity. So we have learned, and even to this day, that children, and I'm saying, when I say children, I'm going to include the teenagers here for now, that they are mildly infected, meaning that they might maybe have fever about half of the time. They could have some cough. The fever, cough, shortness of breath, constellation of symptoms that have been reported mainly in adults probably occurs in about 60 to 70% of the cases. But children, we also know, can have some vomiting and diarrhea in about 15% of the cases. There is the loss of taste and smell we've all heard and learned of, and that can be seen as kids as well. Overall, kids have mild disease. Now, we have learned of this kind of potentially post-infectious kind of disease called multi-inflammatory system syndrome in children. That's been reported, but again, also very, very rare. And I know people out watching tonight might be thinking, well, I've heard of children dying. We've seen some of these reports on the news, especially lately, especially as this conversation of reopening of schools coming up. And I just want to make people understand, if we look at that number, so far, our pandemic started in March. We should all say that, March 13th is when the WHO said it. That's when we started seeing first cases in our region. In the US, from that time until July 4th, there has been reported 26 deaths due to COVID-19. Now, that is horrible, right? That's 26 deaths that we don't want to see happen. Now, but if we want to compare that with influenza that we deal with every year, pediatric deaths every year from influenza are over 150. That's been the last 4 or 5 years. So, and those seasons are literally 6 to 8 weeks. So if we want to do the comparison, this is a much milder disease as it appears at this point in time. So I don't want to say that this isn't inconsequential, but let's put that into perspective, that for the most part, our children are going to do very well with this disease if they happen to have that. So I think we can rest assured that you can do this, but none of us want to see that happen. And the thing we most worry about is if one of these children who are going to do well with it could potentially transmit it to adult, which looks to be a very rare occurrence, and especially one we haven't seen any transmission from a child that doesn't have symptoms transmit to adults. So these asymptomatic cases that we've all learned about with the adults passing into other adults in those situations. So overall, I think children are safe to be doing this. I think our teenagers likely might transmit it better than our younger children. And so sports should be something that can be done, especially with the things put in place like healthcare screening, making sure we're not showing up sick, and abiding by some of these principles that we're putting in place.
And the screening, we had a reader write in about their specific situation. But so if someone does test positive, and then they have to quarantine for the 2 weeks, and then sometimes another extra couple days for the whole family.
Yep.
How will that affect the sports on an ongoing?
Well, this is where this is super important, right? So if we bring somebody in sick into the group, there are rules around contact tracing and who has to be looked at, and how that goes and what kind of things that have been happening at that time. So let's say Sally comes into her soccer practice, shows up with runny nose and cough. No one notices it. We start playing, continues that, and we do, really contact. We're playing hard. We're next to the coaches who doesn't have a mask on. You can argue at that moment in time when we learn that she's positive, that everybody on that team likely has some sort of significant exposure, and now they all are exposed, or they're quarantined for 14 days from the time of their last exposure with that athlete. So I see this question in the chat box where they're like, well, how do we contact trace if we have this athlete decide to go mingle with the football players, and then they want to go to the volleyball players, and they're all hanging out at the party? Yes, that makes this extremely, extremely difficult. Our behaviors outside of the sports field makes this a much difficult challenge, and will help amplify this virus to the point you can't have sports, you can't have school, and therefore our kids lose out. And I think that's super important as we move forward, as our behaviors are likely going to see transmission more outside of the sports arena, outside of these things, than it is going to happen in the sports arena because of all the precautions put in place.
Yeah, I think that's a great perspective. We're entering a new phase here as we approach school too. That if you're quarantined during the summer, maybe that's not as big a deal. Once you're quarantined during the school year, you're missing out on 2 weeks of potentially in-person school, if that's what your school district is doing, and all the inconveniences that come along with that. So I think it's really time to kind of look forward and reevaluate this. You mean the things happening now are a reflection of things happened probably 20 to 30 days ago, that as school gets close, you mean understanding if athletics are going to happen, it's going to have to be in the framework of protecting school time as well. So it's really a tough time to see things rising so rapidly if this is going to work out, because you mean not having fall sports is a very real possibility at this point if things continue on the way that we're going.
Mm-hmm.
That's one of our biggest concerns right now, is with some of the teams and the clubs that are participating over the summer, is a lot of these clubs unfortunately are traveling outside of the area, and traveling, a lot of them I've heard from patients in my office, traveling to areas where the risk and the rate of infection is much higher right now. And so that is always a concern when you go to an area that has a much higher rate of infection, and then you come back to that area. There is that potential now that you've created more of a problem back in the area that maybe actually less of a problem like ours is right now compared to some areas of the country.
Yeah,
And
I
if
think
some
the message for these athletes really need to think about what they're doing 24/7. That you can't be safe on the field and kind of ruin it with everything else you do. That the way things are headed with all these exposures of intermingling off the campus are really seem to be driving the high numbers of young people testing positive, and that's something that puts their sports seasons at risk.
And the patients you've seen in your office that have traveled for sports, have they had symptoms? They're coming to see you for sports related injuries?
Usually the ones that are coming in the office for me are seeing for sports related injuries, not specifically to coronavirus. And so that part of it, I'm not seeing that. It's just hearing about people traveling to those areas and obviously doing a lot of it. And, I oftentimes will ask those patients, what exactly are they doing for precautions? Are they social distancing? Are you seeing masks at these events? And universally, the answer has been no.
It's a bit scary. What we have a question from one of our readers. Where does volleyball fall in terms of risk?
Well, I would say this, right? Volleyball it's indoors. So we think about some of the areas. Indoors is is riskier than outdoors. It's kind of, I think we said it's contact. Did we? I don't remember, guys. It probably fits. Where is it, Mark? You usually remember.
I'm pretty sure that's in the higher contact one.
Yeah, I think it's high contact because they get the close together in that piece. and so it's not I don't feel it's as high risk as maybe something like basketball, but it's there. And I think the principles still need to be in place, right? Like it's going to be, wear the mask when you're not playing, on the sideline. I saw someone had this thing about what about sidelines and in huddles. I think you try to limit some of that while they're playing it. They're going to be there. If we screen them, they should have less risk. But the indoor environment puts them a little higher than I say, but it's probably less. It's definitely less than wrestling. The risk is less than basketball. There's probably a little bit more contact, but do we know? Do I really know and can tell you? No, I don't. And I can tell you that the risk is greater when we have such great increase in cases in our communities.
And I think in our task force, we've tried to kind of put it into two groups for higher risk and lower risk, but that threshold is a little bit arbitrary where it crosses over. Maybe Mark, you can talk about Misha's approach to that. Are they splitting out or are they just taking it all together?
Yeah, so for the high school sports, there's not a stratification that we're doing there. We recognize certainly that there are sports that are going to have much more closer contact, as was alluded to before, when we talk about our sports for fall coming up, girls tennis, obviously lower risk, cross country, lower risk, golf, lower risk. But then when you get into things like soccer, you start to increase that risk. Same thing for volleyball, same thing certainly for football. And again, it's common sense about how close people are and how often they're in that close proximity with each other. People will talk about cross country. There's a whole bunch of runners all at once as being a former cross country runner, which is true, but they start to spread out and they're not kind of constantly one-on-one in contact with each other as the course of the race goes on. So there are things there that obviously can increase your risk, no question.
I have a couple more questions from our audience. Is there a resource where we can see how the sports rank?
There is
on the task force document, I think you can see how we've labeled high and low risk. Again, some people aren't using that stratification, but it maybe helps parents and athletes and coaches kind of think where they fall out. I don't think there's an official sort of top to bottom rank, but that's two buckets to kind of think of. That might be somewhat helpful because the risk is probably different in different sports, and that may affect the parent and the athlete choosing what they want to do. There's
a CDC infographic that I think or an infographic I've seen on social media that's been passed around labeling different levels of risk. These are arbitrary. These are experts that says, hey, I'm going to give you a 1 to 10 ranking and decide. There's no data behind exactly what that risk level truly is. And I will say it's not like we have or know of an outbreak among a bunch of basketball players that were playing in a game where we know one person was sick. So these are the sorts of data that we want to know and see. We do believe probably the outdoor basketball or outdoor soccer is probably a little safer than the indoor basketball if somebody got in, or the indoor volleyball. But what's that level? We don't know yet. I hope we learn from different outbreak settings, as much as I hate to say that, but that's going to help us move forward with different recommendations and how sports proceeds. I love sports. I want my kids playing sports. I love to watch them. However, we have to be careful about which ones are going to happen and which ones aren't.
And the concept of exposures, I think, gets confusing too, as we kind of talk about different sports. And when we think about school, the difference is going to be in school for the most part. Most school districts are going to have their kids in masks. Unfortunately, during a lot of physical exertion, that's not possible. So sports gets to be trickier because you have a group of athletes coming into contact without mask on. So that level of contact and exposure is much higher than kids sitting in a classroom with a mask on. And that leads to more risk of, if one kid has it, all these kids were exposed in much larger numbers more quickly. I think the definitions of exposure kind of vary and are ultimately up to the county when they're looking at tracing a case, what's considered an exposure or not. There's kind of guidelines for 6 feet and greater than 15 minutes, but that kind of all goes out of the door when you don't have a mask on and you're huffing and puffing and running around.
Yeah, Jeff, I think that's super, just to say that is in thinking, and I think in that same kind of question is, at this point in time, we do not have any evidence that a child or even a teenager has spread COVID-19 while asymptomatic to another individual. That's at this moment in time. So we do have some data that suggests that children are less likely to spread the virus as an adult. Now, that does not mean, I want to be very clear, it does not mean that an asymptomatic child is not going to spread at all. but we just need some more evidence, especially the asymptomatic. So that's where the healthcare screening at this point, we have a lot of data so far. I think the healthcare screening can be very helpful in getting kids back to sport.
Mm-hmm. And what is considered exposure? Since we know some people are asymptomatic, or how can you define exposure, and how can parents and the athletes understand when they have been exposed, and then the steps that they can take, to protect everybody?
Well, I think, Jeff kind of just mentioned this, the fact that if you look at CDC definition is within 6 feet, 15 minutes, that's an exposure. However, what are we going to do that with sports? I think Jeff said this very nicely, right? We don't, if you're the nose guard and you're going up against the center and the center is sick, while you might only have contact for a few minutes total, because, right, the total length of play, I don't know. I think I'd call the nose guard exposed. Though the kicker, who hasn't seen anybody, who doesn't get touched, well, he's probably not exposed. I think, I think the health department and in collaboration with teams is going to have to be used to help identify what an exposure is. Now, if you are exposed, if someone says, "Look, you're exposed," you're like, "Oh yeah, I spent the night with my quarterback and he has COVID-19." Well, here's the thing. You need to be quarantined for 14 days. And if you decide to get tested and that test is negative, you are still quarantined for 14 days. A negative test does not mean, please remember this, does not mean that you are not still quarantined, because you can still develop symptoms. So this is a super important point. The health department will guide you and help you, but you should know that going in, so that we're not going out and potentially spreading this virus to more people.
And the other confusing part I think people run into is that an asymptomatic positive, say they were exposed to someone, they got tested, they're positive, that is an exposure as well. We don't know if that kid's going to remain asymptomatic during the next 14 days, or they're going to be sick in 7 days. So exposures to positives, regardless of their symptoms, are exposures.
And what the responsibility of knowing that you're exposed and letting your teammates, is that ending up falling on the coaches? Is that individual families? Is it the governing body? How are we handling, letting everyone know?
There's a personal responsibility there, right? So, and again, we can look at it in terms of, you're positive, you obviously now are infected, you have a risk of spreading that to other people. So are you going to be responsible enough to let people know that, or are you going to hide it because you want to be out there? And that's obviously a concern. And so, if you're the person who's spreading the virus and now your team can't play, that doesn't look very good on you as a teammate. And so I think it's important, if we want to consider and see sports participating and going on through this fall, it's going to be really important for people to be upfront and honest about this. And I've had personal anecdotes of people who are intentionally not telling people, friends as an example, that I think again, it's something that they want kids to play, and we understand that. We want kids to play just as bad as they do, but it's also, we got to make sure that we allow other people to be able to still participate too. And if that means 2 weeks out more of sports, that means 2 weeks out of sports, if we keep things going for the mass group of people.
And it's, I think, really important for the athletes and the parents to notify the clubs or the schools. All of our counties are dealing with massive waves of this virus, that their ability to contact trace sometimes is slightly delayed. So I think most schools are taking an active role in this, that they can get in front of this potentially a little quicker than the county and get the county involved in all those things. So I think it's really important for the communication lines to be open, because not giving that information is really a major problem for continuing to allow this to spread. It shouldn't be a negative thing. There's plenty of people who have gotten this without any clear reason. That, being honest, I think getting ahead of this is protecting everyone, because this certainly, who knows how it's going to, whose parents or whose grandparents end up getting exposed from our young athletes being exposed. So I think it's really important to be honest, have open lines of communication when stuff like this does happen.
Yeah, those are good. I have another question from a reader that they have read about potentially switching seasons. For example, basketball in the spring, maybe baseball in the fall. Is that something you would recommend for schools to consider?
Mark Halstead.
I'll tackle that one right away. So I will tell you with no uncertainty there that that will not be done in Missouri for our sports. It sounds like it's an easy thing to do, but I think there's several things that we need to consider that as well. It is a big logistical change now all of a sudden to switch seasons. I mean, we're only talking another 4 to 5 weeks until technically the sports seasons are starting, and actually technically another 3 weeks until the start of what we would consider our normal fall sports season of actual practices going full blow. That's just around the corner. So saying that we're going to switch seasons is not really logistically possible right now, the way we would look at it. But there's another part of that too. So we already have to remember that we had a bunch of spring athletes who missed out on their spring season. So now if we switch seasons, say we're going to move something like football to the spring as an example, there's two situations there. A lot of those kids are multi-sport athletes. So now they have to pick one of those sports because they will likely both be going on at the same time. That's not really fair to the athlete to say that, because now they are going to have to choose again. This time they'll have to make a choice of whether they can participate in one sport or not. Plus, there also is concerns about injury when we're talking about that too. You know, as someone who deals a lot with concussions, my big concern is head injuries, especially for football. And I get concerned when we talk about like switching a sport to football to the spring. And now we've had 1 full year of constant football rather than having a break from that constant head hitting over the course of a season. So there are a lot of things that I think people don't think about as far as kind of, it sounds like it's just easy to switch things around, but it's not as easy as that may seem. But definitely not, like I said, in the state of Missouri, we are not planning on switching sports seasons at all.
Yeah, many kids don't switch seasons anyway. They play the same sport year round these days anyway, seems like.
It seems like a lot of our viewers want to know about the panelists specifically. If you have children and how comfortable you are with them participating in sports, and what sports they're playing and how you're handling it personally.
So I can start. I have 3 kids, all of whom are teens, so they'll all be in high school this next year. Hooray for me. And the 2 of the 3 are athletes, and the 2 that are participating are in cross country, and my wife actually happens to be the coach on their team. They are handling it actually quite well right now. I think our school district has done an excellent job with communicating with parents as far as the recommendations and sticking to those. Again, it's a very easy sport to social distance compared to other sports. So I think things are going well there, and I hope that continues. Again, I can't say that it is going to continue depending on what happens over the next month or so. But our hope is that it does, and they're handling it well. I mean, again, I'm a lifelong runner, so I enjoy being able to get out there and run still in this, and it's certainly something that's easy to do and still social distance and not have to worry about things in that respect.
My daughters are a little younger. They're involved in dance and swimming, and we've tried to kind of stick to the recommendations of the task force. They had friends going back maybe a little earlier to some of these things than we allowed, but I think they've enjoyed being back, and I think the places they're involved with are doing it in a responsible way.
Yeah, and then I have 3 children as well. One that's about to go to college, so not in sports. And then I have 2 daughters who are both of them are in soccer. Then one is also in basketball. And so I got a little difference here. Their soccer practice, I'm fine with the soccer practices following the phases. My youngest daughter, who's a basketball player, and we love basketball. I mean, that's probably my father and I's favorite sports to watch. And so she's like the only one that's played basketball, so we're super excited. And that's been difficult because even this weekend, there's games and tournaments. And I had to tell my daughter, I said, sorry, dude, no basketball games. We just can't do that. It's not the time. There's too many cases. We're not going to get inside. We need to follow what our task force has come up with. And I think that's the safest. My biggest fear and my reason for stating that is that, we seeing so many cases. If we're playing another team right now, and they have a case, I'm not sure I'm going to know. I'm not sure that I'm going to be able to know the contact tracing, and if we should be quarantining and that piece at this moment in time. And so to me, it's not an easy decision. And I've been very, very open and honest with the club and the coach and saying, this is kind of where we are. I've tried to be open and honest as we move forward. And I feel like that's the best way that we should proceed. And I think all of you out there who are kind of on this fence, because especially if you have high school athletes that are kind of in those years where you're thinking you're going to hopefully have a recruiter. I have a junior that's going to be doing soccer, and that's really big on everyone's mind. And I will say that there's some pressure there that even I have struggled with how to handle it. I have to thank the NCAA, who's made the dead period longer so that they're canceling some of these camps and not putting me in a position where I feel like, oh boy, what am I going to do? And I understand all of you guys out there that are like it's tearing you apart about what the best thing is to do. And I think our task force has helped ground me in the best thing for us to do.
Someone also asked about, the parents on the sideline, if they should be wearing masks, if that helps.
Please, everyone wear a mask.
Yes.
I think from Misha and Missouri standpoint, we are going to be requiring masks for anybody who is not actively participating in an event. So if you're a coach on a sideline, as an example, if you're someone like me who covers on the sideline, I will be wearing a mask. If it's a period, if you're just the player who's not actively playing, you will be wearing a mask. So that will be a requirement for sports for this fall. If you're actually out there participating, you can have a mask off at that point. But we're going to strongly recommend that. And that will also be dependent on what happens with spectators too. Right now, we don't know what's going to happen for spectators. We have a tier of who's essential people to be at sporting events for the fall, similar to what the professional teams are doing and what colleges are looking like. So it may be not so many fans in the stands or fans in the stands at all, in order to allow things participate. So one recommendation we've had from Misha is for schools to consider looking into options for live streaming events, so people can watch from their home and still be able to do that while properly staying social distance from a crowd standpoint.
And the last thing from kind of a big picture is we don't want our parents to compromise the risk of our athletes playing fall sports or things going forward. So why take any risk on the sidelines? You mean we want social distancing, we want masks. If you don't want to wear a mask, maybe you don't need to be on the sidelines during practice, or if you're waiting for your kid, those kind of things. That I think the same applies. Coaches really important. They're right next to these kids. They're in an age group which probably is a little more susceptible and worrisome if they do get it from a kid. So that masks are we realize, I think, really important and our greatest weapon against this, that we definitely shouldn't be cutting corners on masks.
And even if you think you're out there and I can stand away from people and I'll be social distance, wear the mask. You just don't know you're going to come in contact. At this point in time, with what we're seeing in our region, nationwide, we should just buy into this mask thing during those times. Now, you're going to go out and run by yourself, you're going to be out by yourself. That's fine. You don't have to. But in these settings, these public settings, please, please, please wear a mask. That will allow us to get to these activities that our kids need to be in, and it'll put the kids first. And that's what we're going to have to do going forward.
It's a good reminder. And in phase 2, are there stipulations on who can be a spectator right now at the current, our regulations right now?
Yes, there are recommendations. We're still advising, I believe, in phase 2 that there's not groups of spectators involved. Again, we're still in a practice phase with phase 2. We're not talking about actual game competitions. So still for our phase 2 approach, that's recommended that there's not. And, if we go by St. Louis County's recommendations as well, they're not recommending tournaments, yet we're seeing that happening out in St. Charles County and beyond. And again, that there's a reason for that. As we kind of alluded to before, there's a lot of intermingling from places elsewhere, and people are doing that all over because they can find a spot that doesn't have a restriction on that. So I've seen people just move the tournament somewhere else because they've got an open field or things like that, and they're still bringing in tons of people from various areas. And again, that's a concern.
Yeah, I think we wish we had more buy-in with the recommendations we give. And certainly some things are more important than others. Wearing a mask if you're waiting for your kid to finish practice and you're on the sidelines of a soccer practice, probably not the end of the world. And people are, I think, going above our guidelines, and even in the county, not listening to the county guidelines on sports. So it's really a critical time point right here where we're very close to losing fall sports. Some states have gone that route already. That this is the period where we probably need to be rethinking about this, because clearly it's not going away.
And I will say, just to add to Jeff's point, I think that, the people here on this webinar obviously are probably, you're here because you care and you want to do this. We need to really start thinking about how do we start speaking up even more and even push on things that are going to make a bigger difference. Just having youth sports and talking about that and us wearing masks, it's going to take more than that. We definitely know that activities by adults is led to increasing cases. It's not been the kids, right? Because we shut down school before the pandemic really got going. And then we had to go to the stay-at-home orders, and then it went away. And then we started letting go in activities happening. And let's be clear, some of the prime activities are in adults. So we can all say, okay, we're not going to bars. We're not doing things. That we can start saying, hey, we need to shut some of these things down. I hate for any of the bar owners out there, but I think this is what we need to do if we want to put kids first. And so we can have school and we can have sports so that they can get to the things that they didn't get back in the spring.
Yeah, and it's interesting with school coming. There's so much controversy around that in some ways. In some of these groups, school will contain the kids a little more from what they're doing all day, every day too. That hopefully we can be in a better spot going into school than we are now, and have a chance that sports actually can happen. There's a lot of skepticism if that truly can make it through, but I think it's possible. But in our current environment, we're not heading towards that being likely.
And someone also asked, this is a good follow-up to parents being responsible too, is it, who do you expect will be responsible for enforcing these expectations around masks? Is it referees? Will there be police officers? Are the coaches responsible? Who will be enforcing the mask wearing?
Yeah, I think when we're talking about it from a Misha standpoint, I think that's going to fall on the coaching staff for those teams and the athletic directors for the individual schools that are hosting events. As far as enforcing that, that's going to be up to them as far as who they have, if there's a point person or what have you. It's not going to be that cops are going to be running around and putting cuffs on people, but again, it's a matter, it's going to be required. And, I think we've seen in St. Louis County when it became out as an actual rule rather than a recommendation, compliance has been much higher with mask wearing. And I think that's part of the impetus of why we put this in here, is we want this to happen. And again, we're concerned about the kids playing, but our other concern is there's a lot of people on the sidelines who are adults. Our referees, not all the referees are spring chickens anymore, unfortunately. I've been out at many events, and that's a problem that we have at the high school level, is that we're not seeing a lot of people who are interested in being officials, and that could be from all sorts of reasons. But in the big picture of things, we have to look out for them too, because they're going to be spending their time to help our kids and officiate these events. And we need to keep them healthy as well, just as we do any of the coaches that are on the sidelines as well. And I think we just have to look out for that part of this as well.
And I think it's critical for parents to know the guidelines, know the county restrictions, know the state restrictions, and hold your club or your school accountable to some degree if they're not following it, if they're practicing in football and that's not been allowed at all in the county. I think it's never going to be fully able to be policed, because the county's got bigger things to deal with. That I think the parents need to be involved in this and know what's going on.
And we'll post that on stlouismagazine.com. We'll post the document so that people can look at it and then look at their counties. And also this webinar is taped, so you can share this with your community, your athletic department too, if you'd like. And so we also have another reader question. Tom Sullivan wants to know, in football particular, has there been a mouthpiece or face guard or any kind of face protection that's been developed or recommended for football players specifically?
Yeah, I can touch on that one. So there's not a mouthpiece that's going to be protective against this. There is a face shield that a lot of the football helmet companies are devising that would cover the whole face as a potential barrier. The one problem with that we have to think about, though, when we're talking about keeping athletes hydrated on the sidelines, and now you have a full face mask, one of the ways that we used to do that, and again, they're probably going to have to be using their own individual water bottles. Someone would come up and just squirt it through the face mask to get them hydrated. It's going to be really hard to do when you got a big plastic shield right in front of your mouth. So now the helmet has to come off in order to hydrate. So that's one to think about. The other thing, as we've all dealt with myself with these little things here, when I have a mask on or something in front of me, things fog up. And my concern would be, obviously, you're in that situation there and you're breathing heavily. Now you've got a full face mask in front of you. Is how much is that going to be a problem for the athlete for their vision as far as what they're seeing? The last thing a wide receiver wants to do is have a fogged up face mask and turn around and the ball hits them in the helmet instead of their chest and their arms because it's all fogged up.
Yeah, I think it's unlikely that technology is gonna save us with the time that things are coming. And some of the things we overlook probably matter more. All the kids standing on the sidelines, I think I like the Missouri guidelines that these kids need to be wearing masks on the sidelines when they're not in. Football, that's challenging, right? A mask and going in and out. But face coverings like gaiters around the coverings around your neck work great. They can come off the field, they can pull their gaiter up to cover their mouth and potentially limit those exposures, which may be more important. We certainly see that in medicine. We wear masks all day, every day in the healthcare. The spread of healthcare cases tends to be when you let your guard down and you're around your coworkers in the break room or something like that. I think the same applies to sports, that sports maybe not be as risky as we think, but these surrounding activities, team meetings, all those things need to be masked and be on high alert to not be the reason that sports goes the wrong way.
So we had a couple of people ask specifically about soccer, and if it's mainly it's the contact during playing, or if it's more off the field, and specifically what outdoor soccer, what kind of precautions can you take?
Well, it's mainly a lot of the transmission we've seen so far has been outside of the athletics based on what we've been told by the county. And even though we're seeing these increases and rise in youth, we've not had anybody tell us from the county health department that that's due to the actual play. Now, what would we be worried about? Yeah, if we get someone that's sick that starts playing, yeah, there could be transmission. It could be sitting on the sideline. I mean, we are outdoors. It does seem to be potentially better. So we don't know yet in that perspective, but we think that the risk, it could be there if we have a lot of cases. We have people that are sick, hence why we have the recommendations in place. But I want to reiterate, I just saw a news story flash across my phone that suggests that there's transmission occurring during youth sports. That has not been what has been reported to us, and not any of the data that we've seen nationally or anywhere else that suggests that's been happening. Now, with that being said, if we have a lot of cases that we're starting to see, you can say that could potentially happen. And so any of these times when we're congregating, we're being near each other, we can breathe on each other, you could see transmission.
And it's very tricky in a lot of these cases because guess what? Kids don't just play sports together. They do everything together. So you have cases that have so many exposures to the same group that it's very hard to know what role sports plays, but it's probably a lot less risky than a lot of the hanging out and unmasked activities some of our younger population's doing.
And Jason, I believe there were a couple of weeks ago, wasn't there a couple baseball tournaments in Kansas? There was some concerns about some spread at those tournaments, and it may have been an adult issue as far as spread there rather than.
Yeah, I think there is, and what we've been seeing, usually the story has gone adult with disease gives it to kid with disease, and kid gets into the athletic arena, and that's where we're seeing kind of potentially some transmission from that perspective. Still, that's been the primary transmission. It's rare that we've been learning about kid comes into home, kid gives it to adult then goes. It's usually this other, and that's where we're seeing the transmission, which is much different, again, as I mentioned earlier, about influenza. Influenza, it's usually kid gets disease, gives it to adults, and that's always the amplification process. So different here, hence why I think we can do sports safely if we don't have a lot of cases.
We have a couple of questions too about all this time that the children have spent away from organized activity, how can they safely return with respect to injury prevention?
Yeah, I think the value of sports cannot be underplayed from emotional and psychological benefit. I think there's been a recent study kind of demonstrating this time's been tough on our athletes. Sports are part of their socialization, which has benefits, but at the same time, they're going from very little activity potentially to being thrown in very quickly if clubs or schools are ramping up really fast, and there's a significant potential for creating overuse injuries. We see enough overuse injuries in our athletes with normal competition, but rapid changes in activity really set our growing athletes at risk for injury. So it's really important to kind of pay attention to what your kids are doing and try to make sure they're phasing in as much as possible, or they're going to end up in the sports medicine clinic with a sore knee or a sore shoulder.
And I know we've seen the Ivy League just announced they're postponing the fall sports. So if other organizations start to follow suit, are there things that the athletes can do to stay in top form this fall and winter?
Well, again, I think there are definitely opportunities to be active, and I've seen coaches have been very creative with keeping their kids engaged. I mean, we're doing this through Zoom right now, and I know there've been a lot of workouts through Zoom. I was privy to many of those during lockdown, of my wife doing that with our cross country team, of doing that as a group, and they would just do their workouts through Zoom, and it would be their strength training and stretching routine. And then obviously, there's opportunities to do cardiovascular activity. And I think that's probably where I think a lot of people took the shutdown probably the wrong way. It was still okay to, go out and ride a bike by yourself, or, go out and run and do things like that. And kids were just sitting around as couch potatoes. And then we get them back up into sports. So there's still plenty of ways to still be physically active and be fit. It just requires some different kind of thought process and some self-motivation too, which there's some athletes that do that very, very well. And there's some athletes that really need someone prodding them to do that. So it can go both ways.
And I think the route that the NCAA goes will be very, very interesting, but doesn't necessarily mean high schools will go the same way. High schools come from a smaller group. They're going to school in smaller groups together. They're living in the single region. College sports has a lot of other challenges that are a little bit different from high school. So I think, they may all end up in the same place, but it's possible that more college sports could get canceled, but high school sports maybe do okay. They are also, again, slightly this younger group. So I don't think we know exactly what the coming months ahead will tell us in Missouri or even outside of Missouri.
And then with the new guidelines or the revision that's coming out this week, what are you expecting to change, or how do you think our phase will be moving into more phases? We'll go back, we'll stay in our phase, or do we have any predictions or anything that we can look forward to hearing about?
Well, I think you probably heard our concern. You probably heard what we're talking about, case levels. We're kind of hoping to plead with you all watching that we are put in a very, very tough position that, there's no doubt there's no going forward. And you can say suggesting that we're going to stay pat is even probably not the right answer either. So we'll see. I think we're going to look, but you can probably hear in our voices which way we're leaning and which way we like are going to have to go. And it's hopefully is a wake-up call for all of us, and to us to go out and, scream to the hilltops that if we want to have youth activity, if we want to have things that youth deserve and need to do, we as adults have to do more to help protect these things that will make our lives better and make our children's lives better. The risk-benefit ratio lies in the face of children being back in school, children being back in their sports and doing these things. And that's only happening if we do more, which is wear a mask, social distance, wash our hands, don't go out when we're sick. And frankly, maybe start pushing to say some of these other things that are not essential at this moment in time should be stopped. Because if we really want this and put kids first, I believe you can't have it all. We're learning that, and so let's do the right thing for them.
And then what we do in the next few weeks is really kind of critical to where we're going to be August 15th when school's starting. So, I mean, this is our opportunity to try to save fall sports. And I think that's really a critical time where things are going the right direction in our region. And I think we're really concerned where this is going to end up, but we, I think, have opportunities to potentially get headed by the right direction so that when school starts, we're in a better spot.
And again, these are things that we have to remember. These are not going to be forever things that we're going to have to do this. We're just working our way through this. And once we do get through this, then we are going to be able to do things without all these restrictions. So again, a little sacrifice from all of us now will pay big dividends on the back end.
That's great. And can you also remind everyone, so you've spoke about Misha and what people can, how they can search to find these guidelines, and who, if you could say again, who is putting these out and who is on the task force that is rolling out these guidelines?
Yeah, so I think by Friday there should be good updates out there. It sounds like you guys are going to put them on your website. So again, the recommendations of the task force apply kind of to the St. Louis region, but certainly can be overruled by each individual county. So you need to pay attention possibly to what we're recommending, and then understand what your county is doing with these things as well. And then, as Mark said, the Missouri guidelines are in the pipeline now and will be probably talked about a lot in the coming weeks as well. So I think you really have to understand all three aspects of those. And these are moving documents. Every week or two, these continue to change, hopefully in a better way over time. But linking up to those three resources probably is the most critical.
And as far as our task force, so I do want to give credit to all the individuals who have been involved with this. So this project was initiated by some of our colleagues at SSM Sports Medicine, and they brought us involved. They brought Mercy Sports Medicine involved. Brought Dr. Newland involved from infectious disease. We've had a cardiologist on our panel. We have other infectious disease specialists. We've had now county health officials on our panels now. It's been a true collaborative effort. It's been actually very rewarding for me, and you know, in an area where there oftentimes is not a lot of collaboration between health systems from competition there, and it's been really good to see all of us work together. I mean, we've seen that from the top down, from the get-go, from this, with just dealing with COVID in general in the St. Louis region. So it's been really rewarding and really encouraging to see everybody have a common goal here of doing what's best for all of us in our community.
It's wonderful that everyone's working together. I know we all want youth sports to return, so we will see what happens in the next couple of weeks. Hopefully we won't have to have another one of these. But thank you so much for your time.
I'm planning on it.
Again, this is on our Facebook Live, and those joining on Zoom, we are wrapping up our webinar, but thank you for joining us, and we've enjoyed having you. And this is St. Louis Magazine. So subscribe and check out our website.
Thank you.
Thanks, everybody.
Thank you.